So like, how can an ADHDer ask for the right things from their clinician?
When they are working with somebody who knows what they are doing, they don't have to. It is our job as psychologists to ask the questions and to listen. People think that like psychologists, like I'm in the business of giving advice. I tell people all the time, I don't want to give advice because then 2 reasons. Number 1, then I'm responsible if it's the wrong advice.
Sure.
Number 2, my job is to teach you how to solve your problems. I don't want you to be my patient forever. And if you do, wonderful. I love that. But my job is to teach you how to figure shit out, whatever that may be.
Yeah.
So I've gone into my own therapy, addressing my own stuff, being like, I literally have no idea where the fuck to start.
Yeah. Yeah.
And it is not my job or responsibility to problem solve. It is the doctor, the therapist's job. It is to start and know what questions to ask. Because if someone's like, oh, you have a hard time paying attention, if they don't go beyond that, I would be like, I need my money back and walk out immediately. So you can literally come as you are, come with the tears, come with like that. I mean, that's how I show up usually to my therapy sessions and like whatnot. But like, that's what I'm saying. It's, you don't, when you come to see us, especially at our practice, like you can surrender. You really can, because, or anyone that knows what they are doing, especially in this world of ADHD, you don't have to, like, you can take the Barber the Builder tool belt off. You don't have to fix anything. Yes. That is literally our job, to help give you the tools that you can then go heal thyself out in the real world. You don't have to.
So it really all comes back to make sure you find someone who knows what they're doing.
Correct.
That's the fundamental concept here, is making sure that when you do your Google search, that all of the pieces are lining up. Yes. So they say they're an ADHD specialist, but then also their website indicates that as well. Yes. And then also when you give them a call, they're really compassionate. They're kind. They give you reminders. They don't expect anything from you.
And check out their Instagram page. Like, I'm 42. Like, I did not grow up in the world of social media. Social media is a bit of a thorn in my side. Guess what? Like, I have college and high school interns that help with that. I have an amazing publicist who I'm like, literally tell me how to do this. Yeah. We take so much time I did a series in the summer about like what to expect out of a neuropsych evaluation. So people can go watch that and listen to that. What's the difference between an evaluation for school and evaluation for something else? We just had ADHD Awareness Month. I didn't do as much posting because I had the flu and pneumonia at the same time. Yeah. But, you know, we post stuff from, you know, constantly. We make content. You should be able to find their online presence. And by the way, you can also do a consult. Like, we offer, if people want, like, they can do like a 10-minute, 15-minute consult with us, just to, if they want to vet us or make sure we know what they want to, you know, make sure that we're the right fit for them. We offer that as well.
Yeah. Okay. So when someone goes in for a ADHD consult with somebody that knows what they're doing, they should expect to have an interview. And they should expect to have some sort of assessment where they are working with paper and pen in front of them.
Correct. Paper, pencil, some manipulatives, computer, and they will have self-report forms to fill out, which is
in advance, probably.
Yes, and that's what we usually get people in for an intake within a week or so. We always try to, because that's an hour, and we can do that virtually. That's easy.
Yeah.
Why? Because when people call, they don't want to wait.
Yeah, we all know that, but why do we have to wait in so many practices?
Well, it depends, because if it's an insurance-based practice, they tend to be booking out because it's insurance-based, and I can appreciate, you know, that there is a substantial financial investment in this. Even for our practice, like I'm thinking right now, like, what month is this? This is November. We're probably like getting people in at about the physical testing within 3 weeks. We get that intake done immediately.
Amazing.
Just so people can feel like, okay, the process is starting, because they will also have self-report forms if they have parents or a spouse, just to get, you know, perspective on how this person's functioning. As a lot of the tools that we use are designed to do just that, get my information as a patient and get collateral information. And sometimes that takes time. And especially with the school-based evaluations, sometimes the teachers get back right away. Sometimes we have to hunt them down because they're, I don't know, managing a classroom of 20 some odd kids, and they might be feeling. So that process takes time. So we get people in for an intake right away, so they feel like we care. We're starting the process. We get them in as soon as we can for testing, usually within 2 or 3 weeks. and they're filling out the forms in the process. But like I said, we don't take insurance, so I can get people in a little bit quicker. And the marketing and advertising piece for our practice is always tricky because like you want to have patients, right? But like I don't like a 2-month wait list because like I just called a dermatologist for my daughter this morning and they're like, March. I was like, nice try. That's not happening. I have a problem right now. Do better. So I mean, we're getting in on Friday. That was my train ride down here, was handling that. So we're getting in on Friday. But like that's just how I think
anyone with ADHD who is like an adult who is finally reaching out for help.
Yeah.
They're struggling. Like the shit has hit the fan.
Yeah. Repeatedly, probably.
Yeah.
Unless there has been a massive shitstorm.
Right.
Like,
exactly.
You know, it's hit.
So it's like when they're told, we can see you in the summer, they're just like, I need help now.
No, absolutely. Although sometimes we have parents and like the kids, they're doing well enough, but like we need to address this coming from when there's intention behind that. That is completely different from this. Yeah. And we understand that and we get them. And we also know how hard, and I know this, I've been in and out of therapy since I was a teenager, how hard it is to make that first call, text, email, reach out to be like, hey, I'm struggling. I'm having a really hard time with this. That's more than half the battle right there. And we recognize that by the time someone has reached out, that they have had to, put their brave pants on and like make that call, and that they were probably shaking and nervous, and probably for every time right before they clicked send or they called us, they probably hung up or closed out the email or sent it in their drafts a few times before they actually did reach out. And we recognize that. And I say too, like, I'm not in the business of good news. Like, I'm not Santa Claus. Like, I'm not necessarily bringing cheer. When people call me, there's a problem. And it's our job to fix it, period. And give them the information that we can work together on them fixing it.
Yep. For the record, you have ADHD.
I do. It was very late diagnosed because of masking and the wonder that is anxiety that I tend to present with on a regular basis. But yeah, it was a therapist, as you and I were talking before the show, like I was that girl, that bitch in school who had like the high IQ and the straight A's and the really good grades. I slipped a little bit in like calculus and the sciences, and my guidance counselor was telling you, told me like, oh, you're just not good in those areas. Well, no, guess what? Those just had multi-step problems. There were intricacies in there that just my brain struggled with. And like, I wanted to be like the next Al Roker on the Today Show. I wanted to take his job when he retired, or chase tornadoes, but that didn't happen because I struggled in STEM. And maybe that was, like life-saving, because I probably would have gotten like killed chasing the dopamine rush. That would be a tornado, right? So I ended up as a psychologist, but I got to college. I did my undergraduate at Lehigh here in Pennsylvania. And I went from being like student council president, field hockey captain, great grades, to a 1.67 GPA after my first semester, because I had no idea how to study.
Yep.
I had no idea how to organize my time. I had no idea how to start tasks. And the biggest thing that I tell parents, especially when kids are transitioning to college, the bumpers are about to come off, like bumpers from bowling. Like I don't want to say we coddle kids, but wow, the structure that is in place for kids these days does not set them up for success in college. And then they go and they're on their own, and it's like, sweet, here's your schedule, go about. Yeah. And I just stopped going to class because I'm like, well, I always figured it out. But then I got an F in intro to psych. An F in intro to psych.
Oh, I love it.
I apparently have to go and then study for the exams. I just thought I could wing it, and then I didn't. Like, I had friends in the lecture hall, like they applauded when I showed up occasionally. And that was that. In hindsight, should have been a problem.
I just feel like that's so inspiring, though, to the ADHDer who is struggling, who's paralyzed, who is watching daytime TV and scrolling on their phone and feeling like, I'm never going to amount to anything. I failed XYZ. I can't do it. And it's like, no, when you have the right support, you can go from failing intro to psych and having a 1.6 GPA to being an extremely well-educated and successful neuropsychologist.
And there were But I still struggle with it. And how I manage my time, especially now being, a parent with 2 kids, and I'm a single parent. I actually got divorced during COVID. So it makes it that much more difficult. And I have to have that many more systems, which sometimes I pay attention to, and sometimes I choose violence and I don't. But it wasn't even
so good.
It wasn't even until I was in my doctorate that somebody even mentioned ADHD to me. The therapist I was seeing at the time, I was in grad school, and it was either my, towards like the middle end of my first or second year, I don't remember. And I was, I was working in the clinic at our school, and I had a really hard time finishing writing the reports, the extended reports, which require a ton of working memory and organizing and how am I putting the information together? And I was behind getting a report done, and my supervisor was like, "You need to get this shit done." And I'm like so anxious, and I got it done because now there's a threat of me getting yelled at. The dopamine kicked in. I stayed up to 2:00 and I finished it. But the director of our program was like, "You need to get your butt into therapy." And that was because the anxiety, that was the obvious part. But my therapist at the time, it was the end of one session. We had just done like a mindfulness exercise. And she looked at me and she was like, "Is it possible that you have ADHD? I'll never forget this." And I was like, "No, oh my gosh, like, hell no, I'm not that kid who's like the troublemaker, like what we think of when we think of ADHD, like the hyperactive kid. Like, that's not me, bitch. Get the fuck out of here." Like, and then like I was insulted that she even considered me that. So and then over the years, I've thought about it, and I realized how much I mask and what how the hyper focus of ADHD works for me and when it works, and the anxiety and the pressure that I always felt to keep up appearances when like I'm like a duck underneath the water, like I'm frantically going, and to the point where like just last year I started medication. Took me to last year because I'm like, I'm a behaviorist, like I'm gonna put systems in place and like this is gonna be great. And then I was like, all right, Jess, like, do you think maybe you actually need more? Like what the research that you read and what you talk about with families in terms of like what's the gold star treatment, which is medication and therapy. Do you think maybe you want to practice what you preach here, and do that? So I did, and it's changed a lot for me in a good way.
Has it?
It has.
What's that been like?
I mean, it's literally like I'm like breathing into it. Like it's like someone turns the temperature down on your brain. And I'm like, oh, I can actually like go to my computer and like start a task as opposed to walking by it and not starting a task. Like the task initiation and transitioning from tasks to task is so huge. The emotion dysregulation that occurs that I always thought was like just the anxiety or just my personality or me being like unhinged, which like, maybe a little bit, but like, not to dim my sparkle or anything, but like some of that was very directly related to like patterns that I saw in my own day-to-day of when I tried to get stuff done. Lifestyle choices, trying to do stuff when I was exhausted, forget about it. It was literally like I couldn't, not even because I couldn't do it or I had to just push through it. I could not do it.
Yep.
And the meds help with that. But I will also say the behavioral piece and the lifestyle choices, and we talk about this with our patients, is huge. And I tell everyone that I work with, my therapy sessions, and even when I'm doing an assessment, we put I call it a systems check. What are you eating? What are you drinking? How are you moving your body? Are you sleeping? And like, how are you talking to yourself? How are you being kind? Because I don't give a crap how much medication is in your system. If you're not hitting at least 3 out of 5 of those things consistently, there is no amount of medication that is going to help with that. So I've been much more mindful in prioritizing how I take care of myself, so that in conjunction with meds, or if I don't take my meds, because like I lift weights for fun. I love lifting heavy weights, but guess what you need to do? You need to eat.
Yes.
Guess what doesn't happen when I take my meds? I don't always eat. So I'm mindful about when and how I take my meds. I'm mindful of how I eat so I can stay strong and sustain myself to do all the things that I need to and want to do for fun and for necessity too. That was a lot.
I love it.
You have to stop me at some point.
No way. Keep going. I'm loving it.